might start the meeting. I'm sure there'll be others who will end up joining us. So, Ian, I'm going to pass over to you for the acknowledgement of country.
Thank you. We come together today from across this vast continent of ours that we proudly call home. We pause to acknowledge that for countless generations, this has been the home to the First Nations people who have inhabited and lovingly cared for this country, its land, its water, its vegetation, and the wildlife. We acknowledge the leadership of elders past and present and encourage emerging elders to maintain the traditions and languages handed down to them. So let us commit to ongoing healing, reconciliation, respect, justice, as daily we work and walk gently on this land to sustain it for all future generations.
Thank you, Ian. Beautifully read. It's I think one of the things with acknowledgement of country is actually putting your own feeling, heart and soul into it rather than just reading it. It's really is about actually sitting with it and being able to talk. I'm not there yet, but some people who can just go off the cuff and just speak to it. So, which is good. Welcome, Kerry.
Well, that's
Thank
what
you
I had
very
to
much,
do today
Randy.
because that's what I had to do today because I was given very, very little notice. But that's quite okay,
Yeah,
Sandy.
same
I
here.
can generally handle it.
Well, you did well, Ian. Thank you.
We can cope.
Okay, Kerry. So Kerry, just we were just introducing ourselves around which part of Australia we are. So we've got Anna Phillip, who's joining us all the way from Darwin. I'll introduce her shortly. But Kerry, did you just want to let Anna know whereabouts in Australia you're located and perhaps the area that you oversee within Rotary and your EndTrachoma district as such?
Yes, I live in Wyalla, South Australia, which is Bungala country, and I'm the EndTrachoma champion for Rotary District 9510, and most of our items presentations are in that region, which includes Alice Springs.
Okay, very good. Thank you. Thank you, Kerry. All right, I'm just going to hand over now to Rob to give a quick update about from the director's point of view with EndTrachoma and Nourish Our Communities.
Okay, thanks, Sandy. So there hasn't really been any meetings since our last meeting that I've attended. But Anna, we're part of the EndTrachoma working group and also part of the Healthy Homes project, which is being done in conjunction with the Fred Hollows Congress and Melbourne University Indigenous Eye Health Unit. So I usually attend those meetings, and Sandy as well, to represent our project on those. But we haven't had any meetings. We're trying to tee some up for later this month. So not a lot to report in that area. But I did want to just mention, so as I say, we're still not sure what will happen with the WHO announcements maybe next year. But we're going to be reviewing the project and what we do for next year. So I just wanted to put it out there too, if the champions can sort of think about for the next meeting, which is the 3rd of December probably, we'll decide that at the end, but about what they see they'd like to be involved in for the next year or two in terms of the project, because we'll have a review, and I thought we'd have the first meeting of the year next year, because we've still got one more for this year to wrap up the year. Maybe a few ideas about what's happened and what we can possibly do next year. And the first meeting in 26 will then have it like a strategy meeting for what we do going forward. So, because there's potential, as we know, the EndTrachoma is potentially rolling into environmental health areas within the government, within different committees. So, do we broaden that? Do we continue same fashion? What do we do? But so I have a think, nothing today, but next meeting we'll maybe spend 10 or 15 minutes just having a chat about what people think they'd like to be doing or what their views are for the future, and then we can do some planning early next year. So I think that's about all from me.
Thank you, Rob. That's great. All right. Well, I am now going, unless there's any questions for Rob, I'll just do a quick update on the project, because I said to Anna, if you'd like to come and join us and just hear a little bit about our EndTrachoma, and then we're going to hand over to Anna. So let me just share. So the first thing we want to acknowledge is that we lost our beautiful Camille in the month of October. It was very sudden, as you know. So, and we've got in front of you Carol and Camille, and we lost both of these beautiful ladies this year. Carol died in April, and Camille died very suddenly in October. And literally was at Rotary on the Monday night and passed away in her sleep Tuesday morning. They both of them ran the used stamp project and raised over $70,000 from used stamps for EndTrachoma. We've been extremely fortunate. I did go to Camille's funeral, and well, I guess one of the things that was really sitting with me that I didn't feel like we were able to say thank you, because when I drove past her shop on the Friday, it was like I got home and literally Graham then contacted me to say, have you heard about Camille? I couldn't believe it. Anyway, they did say, is there anybody who'd like to get up and say anything? And I'm like, yes, I do. So it was a wonderful opportunity, because twice they had mentioned about the used stamps and how much time she put into it. So I was able to just share a message from all of us and the whole EndTrachoma team, but also Rotary, and there was Rotary Waverley, Monash Glen Waverley were there as well. So a beautiful funeral, an amazing person. You find out things about people, unfortunately, at their funeral, which is not ideal. But she used to ride horses. She used to have Arabs. She bred Afghan dogs. She ran a dairy farm. Oh, she was amazing. And she had her sacred sauce shop. So she was very spiritual. So, but yeah, it was lovely to be there and just to represent all of us. So that was Camille. So a couple of other projects that have sort of been happening is that we've got the towels for WA. The 4,500 that we ordered, 1,500 are going to be going to Yirrkala community, but the other 3,000 are going to the Ending Trachoma project, which is also known as the Environmental Health Trachoma Project. So they're hopefully 24th of November, they'll be delivered into actual Welshpool, and Rotary Carrinyup have offered to assist with unpacking, which is great. Then I've had 2 meetings with the Aboriginal Health Council of South Australia. Met with Professor Katina Denise and also Nathan Rigney, who head up the council. They've been going, I think it was for 11 years. Oh, sorry, no, 50 years next year. Organisation. They've got 11 centres across South Australia. And I've got a picture there of one of the diseases they have to manage, and that's the crusted scabies, what used to be called Norwegian scabies. Thousands of mites, and it looks terrible. So that's just one of the diseases they're battling with. Rheumatic fever and rheumatic heart disease as well, but they are waiting on a 3-year funding grant to be able to support environmental health workers in South Australia. So we're now just having to wait and hopefully they get it, because then obviously they're keen to work with us, just like we've been supporting Northern Territory and also supporting WA. The Minyera community, we've sent up over $5,000 worth of wound care, thanks to Jeff and Essity. So that's will hopefully just about be now there. They had to be delivered to Nighthawk Transport, and hopefully they'll be over, and they're waiting for the delivery of toiletry kits from Rotary Compton, Pambula and Rotary Gawler Light and Interact Club. As far as toiletry kits updates, we've got the Rotary Toronto Sunrise making 10 family kits for the Mount Liebig playgroup. And that's Ian's been instrumental in also working with Toronto Sunrise. We've got the Rotary Molong making kits for Minieri as well. Rob Yule, who's from the Rotary E Club of Brindabella, has been encouraged Rotary Molong to make kits. She has actually used it as a way of trying to engage the members. So I was saying to Rob earlier that, the toiletry kits has almost been like the heart, and it's just fed off to have so many other benefits. And this is an example of our project being used to try and help strengthen the actual Rotary Club. Rotary Beaufort's one club that's actually doing a replenishment of the school they provided about 3 years ago, and Rotary Club of Brindabella have also done a replenishment at Buller Camp this year. Kerry's very close now, Kerry, for the Whyalla Girl Guides kits to go to Santa Teresa. So I was going to give you a call earlier, but didn't get a chance to do that. So let's speak about that one.
Yes, thank you.
All right. And just an example of a challenge, I suppose, is we've got Yuendamu, who Sally has been communicating with as well. They got given 226 toiletry kits a couple of years ago. I don't know if there's anybody here. We actually met online with Yuendamu, sort of talking through the toiletry kits, and the principal was great, very, very helpful. Teachers weren't as keen. But as we know, staff change. And Sally felt the same. There wasn't a lot of appreciation coming out of the school for us to go and fork out send them another 200 kits. So we have Rotary Waverley who have made 100 kits, but we're just having a bit of a think about whether we actually send them to Yuendamu, because, as I've said, I as the project manager have a huge responsibility to make sure that any time a club is making a donation, whether it be toiletry kits or money, we have to invest wisely. And they have to, I say that there has to be a level of appreciation, right? It doesn't cost anything to say thank you, because we've got to protect that money, the volunteer hours that have gone into raising that money. So anyway, we're just keeping an eye on Yuendamu at the moment. They're not really showing us that they would really appreciate the kits. So watch this space. I love this page. Ian, have a look at Bonya.
Yes, look, isn't that wonderful? Yes.
So this would have to be the most photos I've received out of any school, community, club project. I mean, we never get this many photos with this many faces, with that many people approving their photo to be shown. I mean, this is just incredible. So this was the Rotary Satellite Club of Mount Eliza, and they've actually made kits for 4 different communities now. Jackie and her club have been incredible with making. So they organised, so the lice treatment is actually conditioner, just masses of hair conditioner in the hair, lathered up and using lice combs. So they set up a whole lot of conditioner, some T-shirts. Juliet wanted thongs, so they set up a whole lot of thongs. They did their own toilet kits, plus there was somebody from the Mount Eliza community who actually gave over 40 toiletry kits to hand over, and that's, I think, are these pinky ones. So, and then we sent up a whole lot of, I say wound plasters because they can't call them Band-Aids, shampoo, conditioner, towels, toothbrushes, and toothpaste. So that's gone up into Bonya, and as you can see, Juliet was very pleased to receive those items, as is evident with these most amazing photos. And then Yirrkala in September, we actually supplied just about $2,000 worth of goodies to support the Yirrkala event, which Anna is going to speak about in a moment. So I just wanted to share the photos that came through, and I'm sure Anna will actually talk more into these photos or have different ones. But I mentioned back at our beginning of September meeting where we provided face washes, bath towels, fitted sheets, cleaning products, toothbrushes, things to support the environmental health team, Healthy Homes team, going into the Yirrkala community, trying to help them improve the health condition, I guess, of their homes. So that's that's where we are now. It's my pleasure to introduce Anna to you. So Anna used to live down the road from me in Malvern, where her mum lives there. Small world. She actually has been up in Darwin in this role for a year and a half, and prior to that, she was a physio. Wanted to give back, basically, be more involved in health. So left the physio and Melbourne, headed up to Darwin, has done a master's in public health. Is that right, Anna? Yeah.
Yeah.
And is certainly a very enthusiastic and committed worker, just in my engagements with Anna and working with me to be able to provide items for the Yirrkala event. So I'm not going to steal any more thunder. I'm going to now hand over to Anna to tell us about the great work that under the environmental health banner that she's been doing along with a number of other people in the Yirrkala. So Anna, welcome and thank you for coming today. And I'll now hand over to you.
Thank you. I'll just share my screen. We'll just see if this works. That should pop up, but then I'm just gonna. I'll just go into present mode. So then it should be. Can you see that now?
Yes.
Oh, there we go.
Looking good.
Great. And then I'll just get one more thing up so I can see. There we go. Lovely. Yeah, thanks so much for the introduction, Sandy, and thanks so much for everyone for having me. Yeah, like Sandy said, I did grow up right near where Sandy lives, and my grandfather actually did quite a bit of volunteering with Rotary, and I'm not sure which club, but he was in that area. So I wonder, maybe someone would know him, but he's about 96 now, so he doesn't do much volunteering anymore. But I will have to tell him that I am speaking to all of you.
Absolutely. And find out which club.
Yeah, I will. His name's Bill Phillip or William Phillip, so I don't know. I'll ask him. And maybe
Anna, I know Bill very well. He's from Melbourne. Yeah, he's in the same group as me. Bill, yeah, I haven't seen him for a while. He still comes to occasional meetings, but yeah, really good. Still playing golf. Still playing golf at 93 too, I gather.
Yes, he is.
He's an ardent golfer. Yeah, know him really well. Lovely guy.
Yeah, that's funny. I thought maybe he's very well. He knows a lot of people, so I thought maybe one of you knew him. And he spoke so highly about volunteering or helping with Rotary.
Yeah. Give him my regards when you see him. Yeah,
I shall. I'll give him a call later today.
Great.
But yeah, thank you so much for having me, and I'll get onto this. I just mocked up this little presentation. It's nothing fancy. It's just some photos and sort of explaining, giving a bit of context about. We're so grateful for the generous donation from Rotary for this project. And like you mentioned prior about maybe transitioning more into that environmental health side of things, this is sort of along those lines, which is great. And obviously trachoma and ending trachoma is so important. And once it is, hopefully when it does end, there is still so much more that can be done within that environmental health space that has overlap with some of the trachoma prevention strategies, which sort of, comes into this. So I am just going to, let's see if I can turn this. Yeah, there we go. Thank you so much for that beautiful acknowledgement of country. But I just, acknowledge that I'm coming from Yirrkala land. And I'd just like to recognise the elders past, present and emerging. And I'd also like to acknowledge the Yirrkala people, which is the people from Yirrkala, where this project was done. This photo is of Nightcliff, where I live. I'm very lucky to live here. It is very beautiful, but very hot at the moment. So today I'll just give you a little bit of an overview of Healthy Homes, so my role, and and Yirrkala, where we did this project. And yeah, a bit about the Healthy Wanga community cleanup. Wanga is house in Yirrkala, the language that is spoken out there. So we tried to use as much language as we could in our messaging, and then talk about next steps for this project. So the work we've been doing recently has been a lot in East Arnhem Land, so Yirrkala specifically, which is, here's just a little bit of information about it. It's about 20 minutes from Nhulunbuy, which is about a 13-hour drive from Darwin, or an hour-and-a-half flight. Population of just under 800 people living in about 108 houses, community houses. There's 13 different clan groups, and the median age is about 25. So when we think about like public health and health promotion activities, sort of have to think about the demographics and what's going to resonate with different people. So Yirrkala, just a little bit about, RHD, rheumatic heart disease, and trachoma. Although there's not a huge amount of trachoma out there, it's a really transient population because it is so close to Nhulunbuy, which is like the hub where there's an airport and a district hospital or a regional hospital. And because it's so transient, there's a lot of ceremony, and they've got quite strong culture out there. It means there's quite a lot of crowding at certain times. So when we were out there, I was there last week for 2 weeks, and we were doing housing surveys with Housing for Health. And we had to ask people how many people were living in their house, and sometimes there was upwards of 20 people, which is quite a lot. And that doesn't mean they're there all the time, but just with ceremony and things, people come from different parts of East Arnhem or different parts around the territory, really. All the housing out there is managed by Northern Territory Government, with East Arnhem Real Estate managing and supporting tenancy, which is a bit of an interesting model. Sandy, you probably know that the council in Central Australia, like Central Desert region, had their tenancy support program, but here a private company has it, which is quite interesting. And then this project that we ran was in sort of alongside a bigger Housing for Health project, which Health Habitat, an external organisation that housing funds, complete the project where they do repairs and maintenance on all the houses, on all the health hardware. So here's a few images of us doing some Housing for Health work. So we go in and survey all the houses and fix anything we can. So that middle photo is me fixing a shower head. We work with a Yirrkala team, and we fix what we can, and what we can't fix, trades come in and fix the week later. So their motto is no survey without service. So it's trying to get things done immediately. Because a lot of people go in to homes and do surveys, but then it takes a long time to get fixed. So from this Housing for Health project, we did one survey in March, and then they do one 6 months later. So we just did it last week. So from that first project, we noticed some environmental health risk factors that could be addressed. And we created a bit of a community profile with environmental health observations. So these things were like a lot of hard waste. So in that photo on the right, you can see there's a lot of hard waste on the curbside, but we also noticed a lot of hard waste within yards. So council can't pick up anything that's inside the fence. They can only pick things up outside the fence. So we noticed a lot of that, which poses a risk of pest harbourage, and also just dangerous for kids and animals and things. So we created a bit of a community profile, and then we had chats with all the different stakeholders. Obviously, I live in Darwin, and the people I work with live in Darwin. So we really needed to make sure this was community-led and driven. So we spoke to all the stakeholders on the ground and some of the people that we worked with out there. and just said, hey, we're thinking about doing this. Is this something that would that you'd want to be a part of and collaborate with? And there was really positive feedback, which was really nice. So we created a working group with all of those people, and we met monthly for about 6 months, because it was 6 months between the surveys, and came up with a bit of a plan. And what we came up with was the Healthy Wanga Community Cleanup Week. So once the ball got rolling, it just kept rolling and rolling and rolling. So we got the council involved for, I'll talk about all this and how we went about it, but the council was really heavily involved. The Aboriginal Corporation out there, Ridginguru, Anglicare MeWatch, which is the Aboriginal Community Health Organisation, community controlled health organisation, so the clinic, but also they have a big public health team. Remote laundries, so Aboriginal Investment Group have their remote laundries arm, and they're planning on opening one up in Yirrkala, so they all flew out from Darwin to assist. Alpa, who runs the CDP, which is like the local employment, and EnviroBank that do cash for cans, they flew from Darwin as well. And the Rangers, which is, awesome. So there's a little photo of us giving education to a household, talking about pest control and the hard waste collection. So some of the activities we did was a hard waste collection. So this was prior to pest control. So obviously we know with pest control, they can, bed bugs, things like cockroaches and ants and things. Ants can, like Singapore ants, can get into the electricals, which obviously means that then you can't turn on lights, or maybe your oven doesn't work. Rats and things can get in your oven. So all of those things lead to poor health. So your oven doesn't work, you can't cook, or your stove can't cook. And obviously they pose a big health risk. So removing hard waste was going to help with removing like harbourage sites. So we assisted moving a lot of hard waste. We assisted moving 50 square cubic metres of waste. So here's a bit of a map of the community, and you might not be able to see, it's a bit small, but all the little houses, some of them aren't community houses, some of them are like teachers' houses or people working in community, but a lot of them are, and all the yellow are community houses, and that's where they picked up hard waste from. So quite a lot of houses were receptive and helped move stuff from their yard or from their house to the curbside. So here is quite a few photos of that happening. A lot of people helping, a lot of things were moved, which is awesome. So then pest control came the week after, which is awesome. So they went to all the houses after all that waste had been removed, and we gave education about that. So things like asking people to, if they can, get their houses prepped for pest control. So with this, we provided some cleaning products, which you all generously assisted in donating, and that helped with better pest control. So obviously if your house doesn't have sites where pests want to go, then when they do the spraying and baiting, it is going to be better and it's going to last longer. So here's a bit of an example of what we picked up with the Singapore ants in the electricals. So this is a big safety risk, but also it means that you can't use your electricals if there are Singapore ants in there, and they eat all the electrical cords.
Ooh.
Yeah, it's so interesting. We also got animal management involved. So we got the council, who have vets and animal nurses, I think they're called, to come and give parasite treatments and desex any dogs or cats that people were consenting to. Animals, everyone loves their animals out bush, and a lot of the time these dogs and cats are moving in and out of houses, creating a bit of havoc, and making sure that they're treated is going to stop things like ringworm, kids getting ringworm and things like that. So they managed to desex 4 cats and give 19 parasite treatments, and we also gave a bit of like animal management education to families. Again, I just want to say thank you so much for your generous donation. This is Yirrkala. She was so grateful for the towels. She grabbed a few, which she gave to her grandkids, which is lovely. These are the things that you guys gave us, which was so helpful. The laundry capsules were an absolute hit. Everyone loved them. Yirrkala's an interesting one. A lot of the houses have washing machines in comparison to some other communities where not many people have them at all. So having the laundry capsules was great, and it means people could do their laundry. And the bath towels as well. Everyone loved the Band-Aids with the patterns on them. They were very, yeah, they just loved them. And then they were like, where can we get these? And we were like, oh, we're not sure. But yeah, everyone loved them, and the toothbrushes were very well received, as well as the fitted sheets. We gave the cleaning products when we went around house to house, because it sort of went hand in hand with that pest control education and talking about waste and hard waste. The other thing we did buy, which was a lot of people asking for bin bags, that was a big one.
Mm-hmm.
And I think it's just community dependent, but everyone was talking a lot about how bin bags were so expensive in the remote store. And although they have Nhulunbuy 15 minutes away, not everyone has a car to get there.
Mm-hmm.
So that's something we just bought as well, just to give to people to assist with that cleanup. Here we had it'll come in a moment, but we had a Healthy Wanga barbecue day. So yeah, these are the things that we gave out. And then the Healthy Wanga barbecue, so we had all different stalls giving education. Nova Paris came.
Yay.
And then we had the germ giving hand hygiene education. And then EnviroBank did a lot of messaging about cash for containers. They do a colouring competition where they talk about caring for country and picking up cans for the container deposit scheme. Here's some more pictures with the germ and there was a barbecue, and then Nova Paris again. So yeah, just obviously the project went really well that week, but just trying to create more sustainable activities. So we went in last week and did the Survey Fix 2 with Housing for Health. So we went into every single house in the community. We had working with a Yungal team, and we surveyed every house and fixed what we could, and then the trades will come this week and so forth. The remote laundry will open hopefully next year, hopefully early next year. Sometimes these things take a long time, particularly out in community. So that's part of the Nova Paris Social Enterprise Hub, which is opening, and they're going to have things like food ladders and I think a cafe, but the laundry is the main thing, which is obviously assists with ridding bed sheets and towels and clothes of scabies. And although, as mentioned before, a lot of people do have washing machines in their house, these laundries are free to use, so you don't need to buy any detergent or anything like that. They also get up to temperature, so they it's some of the houses that we surveyed, a lot of them just have a cold tap and not a hot tap. Hopefully we're going to continue the container deposit scheme through the council, so cash for containers, hopefully that continues. We're really aiming to keep collaboration between the stakeholders in Yirrkala, particularly the council and housing and the health clinic. They're out there all the time, and often they work in silos. So there's no reason they shouldn't all speak and work together. Like if pest control is happening, they should do their council pickup the week before or 2 weeks before, rather than doing it 3 months later. It's already happening, so why not all have it happen at the same time to make it more effective? Same with the health clinic. Giving health messaging at that same time is so important to link it all back to health. We've also got, the trades will come in, and then Healthy Wanga at MeWatch will continue. But yes, thank you so much for your time and generosity. We're so appreciative. That's just myself there and Tanya, my colleague, who is unfortunately unwell today. And in the middle there is Candice, she runs the remote laundries through Aboriginal Investment Group. And we've, so grateful. And everyone was so appreciative of all of those things. And when we went back last week to community, we saw some of the towels and things in people's homes, which is a really nice thing to see, and they're being used, which is lovely. So we're so appreciative. It was nice to share that story. We're getting some more information from Housing for Health from their surveys. So they survey things like pests and rubbish within the house and stuff. So it'll be nice to be able to get those stats to then see how that week went in comparison to that first survey and the second survey. But they're just collating all their data because it was only last week. But I can certainly share that bigger report with you once it is complete.
That'd be great. Fantastic. Thank you, Anna. One of the things I probably loved about the project that Anna was involved with literally was the number of stakeholders and partners. It wasn't just about one group doing something. It was actually several groups coming together, which is just perfect. It's just perfect. I think, I say we ideally do a very similar thing with our with our EndTrachoma project, whereby the goal is about improving health hygiene, and one of those is actually trachoma. But you're to be commended on what you created, and it was nice that the items that we donated, which was done in conjunction with you, obviously trying to find out what do you need, what can we help with, and thank you for putting our sign up, little EndTrachoma sign there. So thank you for doing that. That was much appreciated. So Anna's goal when we sort of first met, their goal was to get in every house, wasn't it? Your goal was to try and get inside every house. Now that's not easy. So to hear you say that the survey was able to be done in every house is a huge tick. Huge tick. Well done. Really, really well done. So, fantastic. I'm going to ask if there's anybody who would like to ask Anna a question, and go Miss Sally and then Rob.
Thank you, Anna. Just a couple of questions. In that community, how often do the council come round to do the rubbish collection?
So normal rubbish, like household waste, is twice a week, and then up here we call it a cyclone cleanup because they often do it before the cyclone season. Wow. But which is quite funny because in Melbourne I just called it hard rubbish, but they do cyclone cleanup. They're meant to do it 3 or 4 times a year, but oftentimes that doesn't happen just because other business takes priority. And it's a snowball effect. Once one person does it, everyone ends up doing it because they see someone else next door putting stuff out. But it's sometimes hard to get the message across in community, like social media works, but oftentimes it doesn't. So then you tell people to put it out, and then it takes 3 weeks for everyone to put it out. So it's they're meant to do it 3 or 4 times a year, but it usually doesn't happen.
And the other one is just to comment, there was a slide of you fixing a shower head. And I just wondered, yes, it's good that you're doing that, but is there somehow where you could show the people to do some of those things that they could fix themselves rather than a bit of a band-aid thing with you going and fixing it and then it happens again?
Yes, absolutely. So with the Housing for Health project, they don't do it all the time, but when they go to a community and they do it once and then a second time, and they hire a Yirrkala team. So they hire 16 to 20 local community members. And as a part of that, they get employment for those 2 weeks where we do the survey, but they also get training in learning how to do that. So in that photo, I was doing it, but oftentimes the community workers would do it. That was the first one I'd ever done. Most of the time, the community workers would do it. I think, I don't know why I did that one. I think I just wanted to give it a go. But everyone, you would usually do it. And then they do learn to, like, last week, everyone was drilling and we were drilling in hooks and things like that. So that is a part of the project. But that is only 16 to 20 people. So there's certainly a gap in that. And they're trying to get that training as more of a certification. But they're in the early phases of that. Because that would be awesome if they had, because they do all this training for this project, but you don't have anything to show for it other than a certificate to say that you participated, and you got paid. But it would be awesome if it was a part of a cert. But they're working on that. It's quite complicated.
Thank you.
Thanks, Anna. Thanks, Sally. We'll hand over to Rob and then we'll come to Ian.
Thanks, Andy. Anna, thanks very much. That looks great. Great job. And great to get into all those houses, as Sandy said too. I think I mentioned previously we're involved in funding a project, which is a healthy housing officer.
Yes.
Employed with Congress. Do you know Glenn Clark? Have you been in touch with him?
No, but I've met Michelle.
Michelle, okay, yeah, because I just thought, because coordination there, they're doing the same thing as, they're going in and then monitoring how long response teams take to fix things so that we can lobby to try and get better results overall, because it is a big problem about doing the surveys and then getting results, things being fixed. Absolutely. Which is great because in WA, they do that. They go in and fix them as they go. Whereas here in Northern Territory, mostly people are saying we have to wait and come back. So glad that things are happening. That's great. So well done. That's right. So long as you're in touch with them, that's the main thing.
Yeah.
Another question, I was involved with Lanapoi Homeland Association for a while too. Do they get involved in this as well?
They weren't involved in this because they're more to do with the homelands, but they were hoping to try and get something up and running. We actually were out working with what's his name, Ryan. I'm not sure if you know Ryan.
I don't.
He was working on the homelands recently out in housing, at Lanapoi, and they're trying to get things off the ground, but I think they had a recent restructure. I'm not.
I'm not sure if the CEO was a woman who. I'm not sure if she's still there. I've met her a few times, but.
And anyway. I'm not sure if you know, Marnie O'Brien did that report on the Lanapoi housing stuff.
No, I don't.
On that, it's a great report. It's amazing. I'll find it and send it to you.
Yeah, I'd love to see that. Yeah. So anyway, that's good. Other question was, you mentioned about some of the properties being managed by private rental arrangement. Is that working better than the government arranges, or?
It's interesting. We're not sure, and my opinion is there needs to be an evaluation on it, and just because the housing have these what they call tenancy support contracts where they give buckets of funding to different organisations that are in community, which is a great thing, because then they're hot, a lot of them are Aboriginal corps, or they might be the council, like they did in Central Desert. But it's just an interesting model that it's a private real estate company and not a I don't. It's just an interesting model, I think.
Could be better or worse, because often if you get the government involved, it's the administration's not the best. If you
Yes.
get commercial guys involved, then a lot of times they take advantage. It's hard.
Yeah, it's hard to know, and also
Uh,
just the cultural nuances and things
Yeah, and
is a challenge. So yeah, I don't know. I'm not sure. I think like it would be awesome to do a proper evaluation.
yeah, see what works, but it always boils down to the people, of course. It doesn't matter the organisation.
Yeah, that's true.
Just another quick comment. Alpa, we did a bit of work with them years ago, but they were also looking at taking on some of the support for some of the tenancies,
Oh,
stocking more hardware stuff, and also running a support service. I don't know whether it got off the ground, but that was talked about a few years ago, where because normally they're food and other things, but they were stocking some hardware and getting support for the homelands. This was too. Anyway, just where this stalls. But it seemed
yeah.
like a good idea.
They have a little bit. I was in the Apple Store last week. They have a little bit of hardware stuff. I'm not sure with their CDP what their employment
Where they can start.
what they're doing. But we had the nursery team helping, and they just for that week they just didn't do their normal nursery roles, and they just came and helped remove hard waste, and they were so funny. There was like 4 of them, and they were in this big van, and they were like, Anna, we can get a trailer. And I'm like, no, it's okay. Like the council will pick it up. And then like an hour later, I just see the van towing this giant trailer with all this hard waste in it. And I was like, that's the council's job. But it was just
funny.
And is Alistair King, he used to be the CEO there, is he still there at Alpa? Do you know?
I'm not sure. I'm not sure about that.
Just if he is, he was an ex-Rotarian. He was the president of Darwin Rotary at some stage.
Oh, there you go.
He's a really nice guy. I don't know if he's still there, but I had lots of meetings with him. Anyway,
okay, I'll
maybe I'll try Rotary as well.
Okay, maybe I'll reach out to him.
Okay, thanks very much.
Thank you, Rob. Okay, Ian.
Yes, thank you, Sandy. And it is just blown me away the wonderful work that you've done in that community, and your obviously enthusiasm for the whole project. I wonder whether there is any possibility of that project that you have done being expanded into other communities. I spent nearly 2 weeks in Umbludowitch in August, September last year. And oh my goodness, if ever I could see the need for the work that you have done be able to be applied in Umbludowitch. Now, the lack of pride of the locals, it is really sad to see. But one of the big issues that I wonder how you overcame that was one of housing. You had a lot of people coming in, you had to coordinate a lot of activities, whereas in Umbludowitch, there's simply not enough housing to be able to employ the number of teachers that are needed. So how do you, well, so there are 2 issues, I guess. Is that program that you did, that cleaning up, is that transportable to other communities? And how do you go about the logistics of doing all of that?
Yeah, absolutely. And I think we're really lucky with this, with the timing of this, with the Housing for Health project happening 2 weeks after. It meant that all the things we did made everything else more effective. Like I said before, pest control housing now are in charge of that, and they have this bucket of pest control money that each region has to use and deliver. And the councils do hard waste collection. So like, why can't that be conjoined and create more effective pest control and more effective hard waste? Also, oftentimes people in community get overwhelmed with how many different things are coming, knocking on the door, being like, this is happening this week, 2 weeks later, this is happening this week. Sometimes it's better to do it all at once. Other communities might not like that, and that's just the nature of remote communities. What works well in one might not work in another. But I think taking elements of it and trying to implement it in other places is great. And this, again, worked well. We had the contacts in community because we'd been out there quite a few times. So maybe if it's not my team doing it, the model of this could be translatable in other places.
That's what I
and-
wonder whether we could translate it, say to Unblooded, which is in Berkeley Council area. But yeah, I can see every component of what you did there being so applicable in Unblooded.
Yeah, absolutely. And it's also just about what the stakeholders want. And we initially started with just pest control and hard waste and health messaging as well, because that's like where we come from, because anti-health. And so getting Me Watch, the health organization, involved. But you could certainly go to Bladder Watch and see who is interested. And most people are interested in something like this because it is for the greater good. It's going to help people, but it's just about, a lot of people don't have time. Like, their business as usual is so time intensive that having my role, which could sort of coordinate all those little bits and pieces, and then everyone could just like turn up on the day, I think that made it a little bit easier.
So if I wanted to initiate something like this in Unblooded, what would be the starting point?
So I initially figured out who all the different stakeholders were. And once you get one or two, that you then ask them, you're like, who else would be involved? And then who else would want to be involved? Or and then they might put you in contact with 10 other people. And then I just cold called everyone.
We've got the Environmental Health Project meetings that we attend, and it depends on who's actually in Bladder, which is under the avenue of, and it's a bit tricky the way they're set up. I don't know, it's McDonald Range. So certainly Rob and I, well, we'll be attending the meeting again in a couple of weeks, but certainly Bladder, which is not it's not an easy one to be managing. I think somebody who's leading it. So, but yeah, it's you're highlighting something very you can see the value in what Anna's doing, Ian, and also like Michelle McMasters, for example. I've asked her because she's is our environmental health officer, but Bladder, which doesn't fall in their jurisdiction. So
it's certainly an inspiration, a great
100%.
inspiration, and I'd just like to be able to, at some time, make a move to assist that community in Unblooded. So thank you very much indeed, Anna.
About getting the environmental health workers involved. That's the key.
Yes, I think
Yes.
so.
Okay. And that's a challenge in itself, is trying to get workers.
What level of funding would be needed?
Obviously my role, I get paid from NT Health, which is like the time, I suppose. But then everyone else, like, we didn't hire anyone for that community cleanup week. The Housing for Health project is different because that's housing funds that, and that's a really expensive project because it's like $1 million. They get like trades in and they survey everything within the house, and it's a big project, and all the consumables and things like that. But the actual week is pretty. It's not too expensive. Obviously, the travel is the main expense, really, getting people to these places, and that's why getting a local people that are there, or local organizations that are there, is the main thing. And also that helps with communication and getting access and making sure things are appropriate. We put on a barbecue, but that was donated by Ritachingu, the Aboriginal Corporation. That obviously gets people down and gets people talking. And then I did a lot of printing of flyers, but also learnings from it. Like, we could have created a better video or a social media post, which probably might have had more reach, or with like a QR code or something. But even though, I need to think more modern with those sort of things.
Okay.
So will you be able to sustain? Sorry, will you be able will that community be able to sustain the work that you have done?
We hope so, and because everything's all the health hardware will be fixed and it's up to scratch, it means that housing have less of a backlog of repairs and maintenance jobs. So hopefully they can sustain that the housing maintenance to a level. Hopefully, it's hard to know. And then also it's sort of now gets people talking, like Me Watch and council and housing, to now have all met each other and they can all sort of coordinate this, hopefully, on their own, hopefully.
Sally, last question, and then we'll keep.
Yes, thanks,
keep
Sandy.
going. Thank you.
Anna, when you showed us the map of that community, you talked about community housing. So is there a difference in the housing there at all? Can you explain if there is a difference between community housing and...
Yeah. So there's community housing, and then there's like teachers housing, or I don't know who else might live.
Is there private housing?
No one owns their houses in
So they're all paying rent?
Yes. And it's per room, so it's $70 per room that they pay, which is an interesting model in itself.
Is that month or week?
Week.
So that's not just one family, is it? Or it could be, or
it could be. So say, if there's 2 rooms, it's $140 a week, and it just depends how many people are living there and who's on the tenancy. So it could just be me on that, so then I'm expected to pay $140 a week, or it could be all of us on it. Well, I doubt that many people, but and then everyone has to pay their portion of it. But if someone doesn't pay their portion of it, then everyone gets into arrears, rental arrears.
Messy.
Right. Anna, thank you so much for your time today and the information you've shared. And I think everybody can see the value of, say, environmental health. We've obviously got like Mel Stoneham, Dr. Mel Stoneham, who runs the EndTrachoma project over in WA, and they do a very similar thing. Like, you've got 57 environmental health workers employed by the government. There were 75 going up throughout Western Australia. The number in Northern Territory is a lot less, and as I mentioned before, they've got the South Australia Aboriginal Corporation who are trying to get funding to actually be able to have that environmental health component. So certainly not an easy process, but Anna, you've done an amazing job. Well done. And it was nice that we were able to support you in that, and certainly look forward to seeing the results. If you can share it, I can then share it with the rest of the team, because as Ian's identified, there's a definite need in Mbladowitch, and that's just one of many. And then finding out, we fund part of an environmental health worker, Michelle McMasters, but that's just one, and how many are needed. So there's definitely huge room for opportunity. So Anna, thank you very much. You're welcome to stay or go. But again, thank you very much for your time. I really, really do appreciate it. And I look forward to keeping in contact with how else we can continue to support you.
Yeah, absolutely. And vice versa as well. Like, if something does come of Mbladowitch, I'm more than happy to assist or help, or share my project plan as well, which has all the outlines of different things that we did.
We can ask at the next environmental health meeting who has Mbladowitch, and then we can come to Ian with a bit more information. So absolutely possible. So fantastic.
I might jump off, but thank you so much for having me, and have a lovely afternoon.
Will do. Thanks again.
Wonderful.
That's the bill.
Bye. Thank you. Well, hopefully you sort of found that quite informative, because I know I did. We're going to go around the room quickly now. And one thing I just wanted to touch on was that I sent out a list of clubs in your districts that had made toiletry kits just as a part of the first 2,000 kits, just to see if anybody's got any update or any contacts, been in contact with the clubs, just anything to share. So I've got Ian as first cab off the rank. You have been away over in Lake Eyre. You may not have had time, or who knows. So, but just quickly, if you can give us an update of where you're at, what you're planning, that would be really great.
Yep. Right. to answer the question, no, I have not made contact with any of those schools yet. They are on the list. It's right on top of my pile here to get done. So that will be done. And just the other thing that I will mention very briefly, that I'm working with the school principal in Bludowich, Annie Adams, to promote and to further this edible garden project so that we can encourage the families to have healthy food. The Rotary Club of Taree is committed to providing for a couple of gardens. Our funds have been very, very much curtailed as a result of the floods in May. We've only now just started to get our markets back together, but I certainly will be personally funding a couple of those gardens. So just watch this space, because early next year it could be that I'll open it up for others to become involved.
Yeah, well done. I think I mentioned that Kerry had sort of done some work in that area a few years ago. So Annie's been on leave for term 4. So they've got an acting principal at the moment in Mbladowich, Sharon Guilford. Just to let you know. All right. Thank you for that, Ian. And I look forward to hearing about the following up of the clubs, just to see what the outcome is. Tony Freeman has been following up, and he's having fun down in Tasmania today. So quite enjoying it. Is Kerry?
Yes, I've been in charge, in contact with the 5 clubs that did toiletry kits.
Yep.
I have one club I'm going to have to chase up, but and Regency Park, they did have some contact back from the school, but it was a long time ago now, and it hasn't been ongoing. Salisbury is the one I'm going to have to chase up. While here with the Girl Guides, we have had some mailed photos from Neutral Junction School.
Yep.
But that was a long time ago as well. Now there's one more. Yes, they didn't get anything back. I'm actually retiring from the Girl Guides at the end of the year, but
Wow.
yes, but that's going to change plans a bit. But yeah, I mean, I could still do the toiletry bags with those girls though. But on the other hand, it might be time to think of a new strategy, perhaps.
Yep.
I'm very interested in the housing and the Indigenous health workers, and had a bit of a conversation with somebody on Sunday about that, and
right.
so yes, I think
hold that thought for next meeting when we have a little bit of a 15-minute brainstorm. So hold that thought of opportunities for
yes, we'll do.
You can, but thank you for following up those clubs, and I'll just again ask you just to let us know if there's any clubs who do or don't want to actually reconnect or follow up with the communities they have supported.
The ones I've got don't want to reconnect or do any more work because they're busy enough with other things, and I'll follow up the wanker.
Yep, so we'll just get you to pop that in writing, because there might be then other clubs who are willing to reconnect there.
I'm having trouble working with that form you sent over, so I'm going to have to
give me a call. Let's
terrible.
speak. We'll speak.
Yeah, so I'm actually about to head off to Girl Guides. I've had to tell them I'd be late because I wanted to hear the lady from Yirrkala.
Good. No, perhaps fine. All right, thank you, Kerry. And we'll just, before Kerry goes, but we'll just, the 3rd of December, Wednesday, the 3rd of December, does that suit everyone for the last meeting with Santa hats? It's that time of year already.
Yep.
All right, that's lovely. Thank you. Now, next going on to Roz. I don't know whether, did I end up giving you some clubs? Did I get you to follow up with Karen Yup? And just because there was a different sort of setup, I suppose. It hasn't been that the connection with the community, has there?
No, there's no connection with the community. It all goes through Kalgoorlie, through the health workers there, so we don't know which schools it's going to.
Yeah.
And the lady at Karrinyup is
Sandra?
not communicative in any way. So she doesn't share information, full stop.
Yeah, we have
So I don't know what's happening at Karrinyup. Have you spoken to her recently?
Not since you and I last spoke, no. No.
Okay, so I noticed earlier on in your notes that Karrinyup are planning to do the towel folding.
Yeah. Well, not folding, it's just sorting the towels. But I thought I emailed you. I thought I CC'd you in that the last communication. So I will follow that back up again.
Okay, I'll have a look back, but I don't recall receiving anything from you. But yeah, there's so much else going on here at the moment that I may have missed it.
That's okay.
So yeah, I'll have a look back through my emails.
Yeah.
Yeah, if Karrinyup want to do it, that is just fine by me.
Well, she offered it. I just thought, well, yeah, no, that will really help Mel.
The big issue is it depends on where the towels have to go, because Sandra doesn't have the connections in the
They just stay. No, they don't go anywhere.
They just pack them.
They just Bruce Stuffy did it last time with his club.
Yeah.
And they just sorted. What exactly they do, I don't know. But you've got 4. Well, that was 10,000 towels. This is 4.5.
They sort them into colours. They arrange them in packs so you get different colours. So
but Bruce also delivered them. Yes, he did. He arranged for the connection in the community and somebody in the community to arrange for someone to actually.
I think that was a different part, because these were 10,000 towels that were going out.
No, I'm talking about the 10,000 towels.
Yeah, but no, it was done through Mel. There was a different part of it, but anyway, we'll
about
that. Just that, yeah, because I've got photos of Mel sorting them and then they distribute, but it's done in bits. But there was something where he did do something, but I think it was maybe from one community.
All right. Okay.
But yeah.
Quickly, thank Ros for the information about the containers. It looks like that's a bit out of our.
Oh, okay.
But I'm always interested to get the information.
Yeah, there's always something new going on out there in terms of small housing.
Yeah, no, it is interesting. Thanks for that.
Okay.
Sally.
I'm going to do a EndTrachoma presentation down at Hazelwood on the 5th of November. So that's in my old district, and so really good to reconnect with them. And then on the 10th, I'm going down to Kilmore. That's a result of the past president of Wood End is the president of Kilmore. We went down there a couple of months to do a dream cricket program, and he asked if I'd come down and do EndTrachoma, and they are busy collecting stamps. So hopefully we'll be able to do something with our stamps down the track. Thank you.
So just quickly on the stamps, I've just waiting to speak with Monash and Glen Waverley, because I've said, well, we need to communicate to our stamp community about, one, that they won't be going to EndTrachoma, but if you've got stamps, then where to send them, because we can't keep sending them to Camille's store, not fair on her staff. So I'm just waiting for them to come back. I've been in contact with Camille's daughter, Sam. So anyway, but I'll communicate as soon as Monash Waverley have done something. So have you been in contact with any of the clubs?
No, I haven't, but I will get on to it probably next week, Sandy.
No, that's okay. I know you've been busy. Just any communication you guys can get, it's good.
Thank you.
Thank you. Jeff.
Yeah, I spoke to Rotary Club of Kew, who had provided. They've had no correspondence or feedback at all.
Yeah,
they're quite willing to make more, but they're a bit disappointed that they'd got no feedback at all.
And so away. So away, especially when we put all the information in the boxes. But
they're talking to me about making some more, but they would have liked to have had some sort of feedback.
Yeah, no, that's that. Well, this is the sort of information we're wanting to find out.
But if you've got
but I'll
a
just
school
get you
or whatever, Q are certainly interested in making some more.
Yeah, no problem. Well, I'll just get you to put that in writing, guys, when you've had the conversation, because it's so it's a multi-factored response to decide what the step forward is. A bit like Mount Waverley, do we get them to go and provide more kits for Yuendamu, well, if you and me aren't really appreciating, then no, we'll organise them to go somewhere else that will. So that's that. Okay, I think we've done everything there. So sort of on to a general business. Is there anything anybody would like to bring up under general business? No?
Just what we were talking about, getting some photos showing the Essity products so we can send them to them and getting some sort of appreciation.
Absolutely. So we've literally, I'm waiting for the Minieri, the big box to arrive in Minieri. So that's coming up. We've only just received the photos, as I say, from, some for Yirrkala and for Bonya as well. So I wanted to do a few of them to do the certificate. But yeah, the photos have just come through, which is awesome. So certainly not forgotten on the list.
Good.
Jeff, thank you very much. Okay, so the next meeting, Wednesday, 3rd of December, with Santa hats. And the plan will be just to do a little bit of a, as Rob said, about 15 minutes on, what can become possible sort of over next year, and just finding out where you're at. And we'll ideally do a bit of a review of the year, just to present that as well. And yes, and then that'll be the last for 2025. It's incredible, just incredible. All right.
Sandy.
Yes, Kerry.
Could I please have the address to send my toiletry kits to? Because I've looked and I can't find it.
No, that's all right. We'll do that. We'll do that. Offline. You can hang on. You've got to go anyway. You've got to go. We'll speak soon. I was going to say, going to ring you today, but didn't get the opportunity. But I will speak to you.
Yes. Okay. That would be good.
Thank you. So there's anything else? Nothing else? And if there is anything else, stay on. Otherwise, I'll say thank you very much. Enjoy the rest of October. Enjoy November. We'll see you in December.
Thanks, Sandy.
Everybody.
Thanks, everyone.
Bye now.
Bye-bye.
Bye, everyone.
Bye.